Hello, everybody. Welcome to MIO Podcast. I'm your host, Dr. Suresh Rao. I'm a senior oncologist and director at MIO Pumpwell. It's a specialty cancer hospital at Mangalore. Today, I thought I will discuss four important cancers very briefly so that you can know the symptoms and warning signals of this cancer and also know the enormity of this disease and also to know what is the simple treatments that can be done. So basically, I will talk about head and neck cancer, that is oral cavity and hypopharynx, larynx, all these areas. A lot of subsites are there in head and neck cancer. Second is we'll talk about colorectal cancer, that is large intestine and rectum. This is again very common cancer. Then third we'll talk about breast cancer. That is also very common in the West and in India also. Now it is one of the most leading causes of death. Then we'll talk about cervical and uterine cancer. So two cancers mainly in the women, that is breast and cervical cancer. Colorectal and head and neck can happen in men or women. So I'll divide each topic into certain segments. One is we'll take the overview, incidence, that means how many cancers are detected worldwide, India, etc. Death, what is the enormity of the problem in terms of death? Then what are the symptoms, that is early warning signals? Then we talk about treatment. Then we'll talk about survival, that is if you come in early stage, what is the survival? If it is in late stage, what is the survival, that is cure? Then we'll talk about prevention, can we prevent it? And screening. Screening is for normal population like all of us who are normal population, whether we can detect this cancer early. So that's called screening. It is done in normal population, not with people with symptoms. So let us start first with the head and neck cancer. So head and neck cancer worldwide, there's almost 1 million new diagnoses per year. 1 million, that is around 10 lakhs. So this is a huge number, and we should remember that India is the capital of head and neck cancer. In the world, the maximum number of cancers are in India. In the world, it is around 5% of the cancers are head and neck, whereas in India, it's 30%. So death we will talk next about. Death is around 500,000 people die per year worldwide because of head and neck cancer. If you come to India, we have 2 lakh cases, new cases per year. That is 2 lakh new head and neck cancers are being diagnosed every year. And as I told you, the burden is very high because 30%, whereas compared to global burden of 5%. And the death in India is around 1,17,000 per year. That means one death every 4 minutes in India. That's why it's very important, so that we should know how to diagnose this early. So that is regarding incidence and death and number wise worldwide and India. Next we come to symptoms. What are the symptoms? Symptoms means like warning signals. So this should be very important for anybody above 40, especially those who are having habits like smoking, alcoholism. Smoking means tobacco or cigarette, bedi or gutka, pan, all these things. So these are important things. The symptoms is if you have throat pain or difficulty in swallowing, that is one symptom. Second is lump or swelling in the neck, if there is a swelling here in the neck. Third is change in voice. So when you speak, others may find there is some change in your voice, your family or your friends. One more is persistent ear pain. You have some ear pain, persistent. And one more is I find commonly the patients are unable to eat spicy food because there is some ulcer in the mouth or in the oropharynx while they are unable to eat spicy food. So these important symptoms, as I told you, throat pain, lump on the neck, change in voice, persistent ear pain, unable to take spicy food. If this is there, especially above 40 and for 2 weeks, don't wait for 6 months. 2 weeks, I'm telling you again, it is very important the time. So if it is there for 2 weeks, you have to go to the doctor and get it diagnosed. So out of this, there may be other silent features also, but these are the most important. 80 to 90% come with these symptoms, warning signals. Now, what is the treatment? Stage 1 and stage 2 in oral cancers is generally surgery or radiation. That is very important. Once it becomes stage 2B or little bit more, and stage 3, some factors in stage 2 and stage 3, you need surgery, radiation and chemotherapy. So stage 3 and stage 4, especially sometimes radiation, mostly chemotherapy and immunotherapy. Stage 4 is, that is, it has spread to lungs or liver, bone, etc. like that. So stage 1 is only one treatment. Stage 2 or 3, when it comes, there will be multiple treatment. And stage 4 is always very difficult. So next, we come to survival. So we have finished incidents, we have finished warning signals, we have finished treatment. Now we talk about survival. Survival as per stage. That's why we say that 2 weeks criteria is very important. You should not delay. Stage 1 is around 90% survival. 70 to 90 we say, depend on different sites, but 90% can be cured completely. When you come to stage 2, it becomes 60 to 70%. 75 may be the maximum. When it is stage 3, it is 40 to 60%. Then we go to stage 4. There we have A and B. A means it is around in this area only, in the neck. It's even then it is around 25 to 40%. Stage 4C, when we say, it is metastatic. That means it has spread to lungs, liver, etc. So it is less than 10%. So this is all we say 4-year survival, and then it will translate into cure actually. So it is very important here for you to remember that first stage is 90%, whereas fourth stage is less than 10% you can survive for even 4 years. It's very difficult. So stage is very important. And also it depends on subside and also HPV. All there are other factors also which depends on which your survival can be determined. So prognostic factors we say. Next we go to prevention. Now we have finished survival. We go to prevention. Prevention, we know, all of you know what are the main causes of head and neck cancer, that is oral cancer. Tobacco cessation, that is you have to stop smoking. Smokers or smokeless. So risks start reducing after within 5 to 10 years. So that is if you stop today and you continuously quit that habit for 5 years, you will come towards the normal population risk. So after 5 years, you will get the benefit. So it is worth stopping even today. Now, beetle neck or areca avoidance. So eating areca daily so many times, it's also one of the cause for oral cancer. So prevention is by stopping smoking, stopping or avoiding beetle nut. Then there is this HPV vaccination also, which is important, can be done. It is done for cervical cancer. It has can be done for head and neck cancer also. Then one more thing important is occupational safety. That is masks for toxic chemicals, agriculture sprays, dust, and BD industry. So you have to wear mask, cap. All these are very important. People take it lightly sometimes because of inconvenience of wearing a mask, cap, etc. But it is very important because this cumulative effect offers happens over 10 years. After 10 years, you find these problems. So people will tell me, sir, I don't have smoking habit. I don't have any problems. How do I get this cancer and all? So, but they will be working in some industry without proper protection. Next is healthy lifestyle, fruits, vegetables, physical activity, and oral hygiene. So, you have to, if there is sharp tooth, you have to go to the dentist regularly. All these are very important. Cancer is a disease which take 20 years to happen. So, you have so much time to take care of yourself. So, all these habits are persistent. You have to do it daily and you have to continue it. So, now prevention is done. Next, screening. Screening is like I told you, the normal population. Can we have any screening program? For actually, for head and neck cancer, there is no universal screening program. So one is oral visual inspection. That means to see the oral cavity. You can ask the dental doctor to see. You see yourself. So it's a regular, every month you see the oral cavity, especially for smokers who have habits and you are above 40. You have to keep regularly checking once a month. Then if there a white patch or red patch in your mouth, in the oral cavity, on the tongue, on the palate, on the cheek, if there is leukoplakia or erythroplakia, we say, white or red patch, you have to monitor it, show to the doctor. If there are some problems, then you can also have, for high risk population, endoscopy. Then there is something called toluidine blue stains or brush cytology. That also sometimes we do if there is suspicious area. So every 3 years for high risk individuals, you should keep doing this toluidine blue, or if there is a doubt, you have to do this scopy. So every 3 years at least, you have to do this screening program for yourself. So now this is over for head and neck cancer. Next we'll talk about colorectal cancer. So we go in the same sequence: overview, incidence, death, symptoms, treatment, survival, prevention, and screening. So it will be easy for us to remember. So now first we go to incidence and death of colorectal cancer. In the world, we have 2 million new cases of colorectal cancer. 2 million, around 20 lakhs new cases. And almost 930,000 deaths. That means uh, almost a million deaths, 10 lakh people death. So the 2040 projection is you will have 3.2 million new cases worldwide. So we are talking about global incidence now. So 3.2 million is around 32 lakhs new cases worldwide, and 1.6 million deaths per year all over the world. That is 16 lakhs people will die because of colorectal by 2040. Global deaths is around 21,000 deaths per day. That is 2 deaths every minute. So that is the enormity of the problem of colorectal cancer worldwide. India, the number is still less, but it is increasing because of our diet, changing lifestyle, etc. India, around we have 70,000 new cases per year and 48,000 deaths per year. That means 112 deaths per day. That if you calculate, it comes to 1 death every 15 minutes in India. So that, again, it's a major problem. One person in India is dying at every 15 minutes because of colorectal cancer. Now next we go to symptoms. So we have finished incidence and death, we go to symptoms. What are the symptoms in colorectal cancer? So you have to again be here very cautious. All cancers, 90% of them will give you warning signals, the body will tell you, but we sometimes ignore and we delay it. Now symptoms in colorectal cancer, generally colorectal cancer is at 50 years and above, but it can come at 40 years also. And if there is a family history and genetic predisposition, it's all even more earlier. You have to be careful if there is in family some genetic predisposition. So I will not go into detail of that. Now we'll come to symptoms. Altered bowel habits, we say, diarrhea, constipation, pain. So you are normal. Suddenly at 45, you get diarrhea, constipation. For 2-3 weeks, you are suffering from this. This is the one of the symptoms. Thin stools, we say pencil thin stools. That means stools are coming in very narrow way. That is one more symptoms. Rectal bleeding, if there is blood in the motion. Mucus in stool, that is there are mucus in the stools. Feeling of incomplete evacuation, that means you have gone to pass motion, but you feel that it is incomplete. Still you feel you want to go again, some feeling of incomplete. Then change in appetite, weight loss. Slowly you feel that your hunger is less, you're losing weight. Then low hemoglobin. If you check your hemoglobin, if you're tired and if you check your hemoglobin, it may be low. So during in the especially in the ascending colon cancer on the right side, you can get low HB. That means little blood will be going every day. We will not know it unless you do fecal occult blood, and there are many tests for that. Anyway, low hemoglobin. So the symptoms for colorectal cancers are altered bowel habits, diarrhea, constipation, thin stools, pencil thin stools we say, rectal bleeding, mucus in blood, incomplete evacuation, change in appetite, weight loss, low hemoglobin. So these are the symptoms, and above 40, if anybody has these symptoms for more than 2 to 3 weeks, please do not ignore. It may be piles, it can be indigestion, it may be so many things, but mostly you should have a diagnosis. If it is infection or something, it will be settled in 1 week to 10 days. It should not persist. So it can be Crohn's, so many other non-oncological diagnoses will be there. But you have to get a diagnosis when you are above 40 for high risk people or above 50 for others. Next, we go to treatment. Treatment for colorectal cancer is, if it is in the first stage, this colorectal cancer, again, I want to tell you, it is a very slow cancer. What we say, tumor doubling time sometimes is up to 200 days. So you have so much time. So we should not ignore it. Stage 1 treatment is surgery. Generally, it will be surgery. Stage 2, it will be surgery plus chemotherapy, and rectal cancer sometimes radiation, surgery and radiation. So even chemotherapy is only for some cases. Even radiation is for very few cases. Stage 3, you need surgery, chemotherapy, and radiation. We need all three. Stage 4, mainly chemotherapy. There are new drugs like targeted therapy now and immunotherapy. So in stage 4, you have chemotherapy, targeted, and immunotherapy. In stage 3, surgery plus chemo plus radiation, all three. Stage 2 surgery, sometimes chemo, sometimes radiation may be added. And stage 1, generally, it's only surgery. Now, after treatment, let's go to survival. What happens in survival? What is the chances of getting cured of this colorectal cancer? Stage 1, it is around 90 to 95% cure if you are coming in stage 1. Stage 2, it is around 75 to 80%. Stage 3 drops to 50 to 70%. When it comes to stage 4, it's around 10%, 4-year survival. So generally this stage 1, stage 2 and all, it will convert to complete cure. But stage 4, you can survive maximum 4 years, 5 years. Sometimes some people survive longer with all these new treatments. But cure is very rare. Next, let us go to prevention. Can we prevent this colorectal cancer? What are the uh, things we need to do to prevent? 74 to 80% of colorectal cancer are preventable. How do you prevent? One is diet, high fiber, low red meat, very important. Physical activity, that means you have to walk, you have to exercise. Weight control, you should see that your weight is under control. You should not be obese. Alcohol control, no over excessive drinking of alcohol. Again, tobacco cessation. And calcium and vitamin D supplements. You should have all these. This is called preventive measures. So it is a 70 to 80% preventable. Next is we go to screening. Can we do screening of colorectal cancers? This is one of the cancers where screening is universally available. So generally what we say is colonoscopy at 45 to 50 years, every 5 years. If there is family history of colorectal cancer, then maybe this colonoscopy has to be done younger, and you have to do a genetic counseling test, all that is there. But anyway, it is at 45 to 50, everybody has to do colonoscopy. Stool for occult blood, so you have to send stool for occult blood, and this is also done every 3 years. And at that age, 45 or 50, there are different ways of doing, checking whether there is blood in the stools. Not what you see, but you are doing is for occult blood, that means what you don't see. So there are many tests for that. You can do it, and if it is positive, then further next what is to be done will be told to you by your doctor. If there is family history of colon cancer, as I have told you, start screening by the age of 35 years. In fact, there are different guidelines, but anyway, you have to start maybe at least 10 years early. So screening is there. Colonoscopy, stool test for occult blood are the two most important screening tools for colorectal cancers. Again, I would like to remind you that in Western societies, 80 to 90% of these cancers are diagnosed in first and second stage. And in India, unfortunately, most of them come in third or fourth stage. So we have to see that we come in first or second stage, because the success is very high. I want all of you to be very vigilant, and because cancer is a disease which is very difficult to treat once it is in advanced stage, and if it is first or second stage, it can be completely cured. And only thing is, we cannot blame the doctors or the health sector for delaying the diagnosis, because if you come late, nothing much can be done. So we have to be very intelligent, we have to be very curious, and any symptoms, please don't take lightly. There are multiple signs and symptoms which can be helpful in diagnosis cancer in first or second stage. So I request all of you to be wary of these symptoms and take care of your health, modify your lifestyle, and respond to these calls from your body, and meet the doctor as early as possible. Thank you.